Welcome to the 25th anniversary of National Black AIDS HIV/AIDS Awareness Day virtual event, brought to you by My Brother's Keeper in collaboration with Let's Stop HIV Together. Good afternoon, everyone. I'm Brandon Holmes, Director of Media and Creators here at My Brother's Keeper, and it's my absolute honor to be your moderator on this landmark occasion. Today marks the 25th anniversary of National Black AIDS HIV/AIDS Awareness Day, an initiative that began in 1999. As we gather in this digital space, to commemorate this day, we focus on a theme that resonates deeply in our hearts and communities: engage, educate, empower, uniting to end HIV/AIDS in Black communities. Engage, discussing ways to better involve the Black community in HIV/AIDS prevention and treatment efforts. This can include outreach programs, community partnerships, and utilizing local leaders and influencers to promote HIV testing and destigmatize the conversation around HIV/AIDS. Educate, focusing on improving HIV/AIDS education among Black youth and adults. This could cover the latest research, treatment options, understanding of PrEP and PEP medications, and debunking the myths that contribute to stigma and discrimination. Empower, highlighting success stories, strategies that have effectively empowered Black individuals living with HIV/AIDS. Empowerment can be through advocacy, policy change, access to care, and support systems. Today, we are privileged to have with us an extraordinary panel of speakers, each a leader in their field. Dr. Robin Neblett-Fanfare. Dr. Neblett-Fanfare served as the Acting Division Director and Principal Deputy Director for the Division of HIV Prevention at CDC. In her role as Principal Deputy Director, Dr. Fanfare helps direct division programs and provides strategic direction and management for policy, research, surveillance, programmatic efforts. Prior to this role, she led research activities to enhance engagement and retention in HIV care, increase viral suppression, and improve the quality of life for people with HIV. Dr. Fanfare also led the division's TREAT pillar work group supporting the ending the HIV epidemic in the U.S. initiative. Beyond these roles, she has been active in preparedness and response, deploying to support emergency responses for Ebola and Zika viruses, Hurricane Irma and Maria, and COVID-19. A board-certified internist, she served as a primary care provider for veterans living with HIV at the Atlanta VA Medical Center. Dr. Neblett-Fanfare received her BA from Brown University, MD from New York University School of Medicine, and MPH from Johns Hopkins Bloomberg School of Public Health. Dr. DeMark Hickson. Dr. Hickson currently serves as Executive Director at Us Helping Us People into Living Incorporated. Before onboarding at Us Helping Us, Dr. Hickson served as Associate Professor of Biostatistics, tenure track at the Department of Epidemiology and Biostatistics in the newly established School of Public Health at Jackson State University, as well as Chief Operating Officer at My Brother's Keeper Incorporated. Importantly, Dr. Hickson was part of the team that opened the Open Arms Healthcare Center, the first LGBTQ-focused primary healthcare center in the state of Mississippi. Dr. Hickson works includes community-based advocacy and environmental and policy system changes that are effectively informed by a comprehensive program of health disparities and health equity research into the salient life course, psychosocial and multi-level factors that impact cardiovascular disease and related risk factors, and HIV/AIDS among racial and sexual minority, especially in the American Deep South. He currently serves as principal investigator for several federal and foundational funded programmatic research studies and environment and policy change initiatives that aim to understand the underlying determinants of health, improve the local food systems, and create a culture of wellness, health and wellness. Dr. Hickson has published nearly 80 scientific manuscripts in peer-reviewed journals, including the American Journal of Public Health, American Journal of Epidemiology, and AIDS and Behavior, and serves on several boards, including advisory boards for ViiV Healthcare and Gilead Sciences. Christopher Walker. Christopher Walker served as an external affairs community liaison at ViiV Healthcare, where he continues to channel his passion for advocacy. He strives to combat disparities in healthcare and education faced by underserved individuals. Previously, he served as an HIV test coordinator and field supervisor for the CDC-funded National HIV Behavior Surveillance. After receiving his master's in public health from the UT Health Houston School of Public Health, he worked as a project coordinator at ETR, Education, Training, Research, a nonprofit organization dedicated to addressing health disparities outside of his professional endeavors. Christopher proudly served as a board member of several community-based organizations that provide resources to people affected by HIV, and is the president of Gulf Coast Kiki Ballroom Sing Alliance and a podcast host. Today's conversation will cover a range of topics, from effective strategies in HIV prevention and treatment to the critical roles of community engagement and policy. We look forward to gaining insights from our speakers about their experiences and perspectives on uniting to end HIV/AIDS in Black communities. I encourage our audience to submit, if you haven't already, to submit where they're from in the chat, and you have any questions you may have for our panelists for the Q&A session following our discussion. Let's embark on a day of insightful conversation and learning, commemorating 25 years of dedication and progress in the fight against HIV/AIDS in the Black community. Dr. Fanfare, we're gonna start with you. How you doing today, Doc?
I'm doing fantastic, Brandon. Thank you for having me.
Good to hear. All right. How can we address racial and ethnic disparities in Black communities around assessing HIV treatment and prevention methods such as PrEP? Now, here's an insight, and I know you're well aware of it, but it's just for the people at home. Estimates suggest 94% of white people who could benefit from PrEP are prescribed. Only 13% of Black and 24% of Hispanic. Your thoughts?
Well, my thoughts, once again, thank you for having me. NBHAAD is one of my favorite awareness days, and it's such a wonderful space to be able to come together as community. Even starting with these backgrounds, it just feels so powerful up in here. So thank you to all of the organizers for putting this all together. You started at such an important place, Brandon, and we'll focus on PrEP, but also even just HIV treatment. HIV testing, the stigma around HIV. There's so many disparities, and I love how you called out that this is the 25th anniversary. And I couldn't help but think, dang, we're still dealing with so many of the same issues that we probably were at the first NBHAAD. And not only that, but some of these disparities really continue to widen. So anytime I talk about disparities, I always want to make sure that I put out why we have disparities, because I think some people who don't do this work might think, oh, it's individual level factors or it's people's behaviors. I think it's really important that we highlight the systemic inequities that we as Black people have faced since the beginning of time that continue to drive these disparities. So when we think about inequities in employment, when we think about the impact of racism, homophobia, transphobia, mass incarceration, residential segregation, things you wouldn't necessarily think align, they really do move these disparities that we're seeing forward. So where are we today? We have 1.2 million people who are living with HIV in this country, and 1.2 million people we estimate are vulnerable to HIV and should receive PrEP. You so eloquently put out the disparities that we continue to see with PrEP and them widening. We also know that our Black and Hispanic same gender loving men continue to carry the large burden of HIV. And when we look at cisgender women, Black women make up 13%, but constitute well over half of the new HIV infections. And then we look at the South. The South makes up just about half of new infections. So we have all of these disparities that are really driven by these longstanding inequities. So when we think about how we can address, I think there's a few things that we have to think about. First, we talk about engage, right? Community engagement, true community engagement is so important. How do we meaningfully involve Black people with HIV, Black people vulnerable to HIV? Because community knows what community needs. So I think really thinking of the way that we engage and bring people into our spaces and listen when we're engaging and feed back bidirectionally is really important. I think whole person approaches is really important. A lot of times us in HIV spaces, that doesn't necessarily mean other people are going to access or come into those spaces. So how do we bring HIV prevention, testing, treatment services where people are already seeking care or where they want to seek care? So one thing we're really excited about is the Together Take Me Home HIV self-tests. People have been ordering that as fast as they can, and meeting a lot of Black people who had never tested previously for HIV. So I think that that's a way that we can think about breaking down those traditional models and meeting people where they want to be met, or where they're already seeking care. Family planning services, sexually STD clinics, women's health clinics where people are receiving gender affirming care. How can we bring HIV prevention, treatment, testing into those spaces is really important. And then I think it's so important for us, especially on NBHAAD, but always to really frame this work through a justice lens. I really do think that this is one of the justice issues of our time. We're speaking specifically about racial and ethnic disparities, but it's about reproductive choice. It's about public health justice. So when we think about it through a justice lens, it's not just about HIV prevention, testing, and treatment, but also the things that continue to impede access, specifically for Black people. It's about accessing safe and affordable housing, transportation, income inequality, all of those spaces. So I think really starting to kind of articulate through a justice lens is going to be really important to help us move the needle when it comes to these racial and ethnic disparities that continue to persist because of longstanding systemic inequities.
Thank you for that. Mr. Walker, Dr. Hickson, any thoughts on that?
I think Dr. Nesbitt Fanfare a
She nailed it, huh?
wonderful, yes, nailed it. That there's not anything else to really add to that, but yes.
All right. The next one is for you, Dr. Hickson. As a researcher focused on health disparities, especially in HIV/AIDS among racial and sexual minorities in the Deep South, what key findings can you share about the unique challenges and barriers faced by these communities in accessing HIV/AIDS healthcare and prevention services?
Yeah, thank you for that, Brandon, and thank you to the organizers for having me. It's difficult to come after Dr. Nesbitt Fanfare because she touched upon a number of the things and the important factors that we need to fully understand as we look at factors that contribute to HIV in the Black community. I want to also say that we have to think about each of the subgroups within the Black community when we're thinking about research, and we can't consider everybody together. And it's not that we don't want to, but each of the subgroups and subpopulations have different and unique characteristics that we have to understand individually. And I say that because we first started off, whenever I first got into this research game and academia and community-based research, for example, we collected data collectively on Black sexual minority men or men who have sex with men and transgender women, right? But we know that transgender women have a unique and diverse and more nuanced context. We have to continue to unpack that as separate from Black sexual minority men. And so I'll start with Black sexual minority men first, because it's, as Dr. Nesbitt Fanfare mentioned, that when we were doing research in Jackson, that we noticed what we coined the Black sexual minority men paradox, where we know that Black, gay, and bisexual men engage in equal or lesser HIV transmission or acquisition behaviors compared to white sexual minority men. So that tells us, as Dr. Nesbitt Fanfare said, that it's beyond the individual level behavior. So it's all of those things before someone gets to engaging in HIV transmission and acquisition behavior. So it is the racism, it is the discrimination, it is the heterosexism, it is the expulsion from families, it is all of these higher level factors that's beyond the individual that contributes to someone engaging in HIV health-seeking behaviors. And so there was one paper that recently came out of Jackson, in fact, where it reported that Black, gay, and bisexual men who lived in low or high poverty neighborhoods were more likely to experience hate crimes, right? And so these hate crimes and living in these neighborhoods then contributed to lower engagement into PrEP services. So as you can see, it's all of these upstream factors that prevent individuals from engaging in HIV health-seeking behaviors. And so we could continue with Black trans women, right? So we think about the mass amount of violence that they experience, even just on the streets, right? So, and then how they're having and how they navigate life is different than other subpopulations. So it's really drilling deeper into these subpopulations to really understand these factors. And I think is one piece that's maybe not within a research study, but it contributes to research, is that we need to have research in which the investigators are culturally congruent to the participants, right? So it's kind of my soapbox that I've been standing on lately of having non-Black folks research Black folks, right? And so as someone who just doesn't have a true understanding of the context in which Black folks live, the history of the Black community, and just having somebody on the research team as a recruiter that is Black is not enough, because it's not informing what the focus and the direction of the science is going to take place. Thanks.
Okay. Walker, you have anything?
No, I think that Dr. DeMar really hit the needle on the head. When I think about just how we research, it's primarily like within Black communities or communities of color. Sometimes it's not fueled with innovation. And I think in order to really get the true essence of what folks impacted by HIV, especially Black and brown bodies, we have to be innovative in our recruitment methods. We have to be innovative in our research protocols, but we also have to think outside of the box when it comes to research, because oftentimes we see the same people at the same tables in the same focus groups as the same key informants. And so when we start to engage in research, we have to think outside of the box. How can we reach not only our mainstreams, but how can we reach our extremes? So those folks within those subpopulations who are not traditionally a part of the conversations. So sometimes it takes for us to get those folks from those communities to hire them, to train them so they can go and reach out to those extremes so we can get a more vast picture of what our community needs, right? Because we tend to over-research those people that we have access to and then under-research those people that we can't reach. And so then the data is skewed and it's not a true depiction of what's going on, because we didn't take the extra initiative to refine what recruitment can look like for those people who could have been a part of the research.
Right. And to Dr. Hickson's point, we have here at Jackson, we have reached out to homeless shelters, reaching them where they are, domestic violence shelters and things of that nature, for those that, as you mentioned, that may not have access to the care, may not have transportation for care, and mainly don't have the education to get to know that they need care. So those are great points. Okay, all right, Mr. Walker, based on your experience at ETR and as a board member of various community organizations, how do you view the role of nonprofit organizations in reducing the incidence of HIV and supporting people affected by HIV?
So I'm gonna say it's simple. In the nonprofit space, we have a term that would say meet the people where they are. Yeah. And so traditionally within nonprofits, for the vast majority, what you do, your processes are ran by grant funding, but you can write for that funding. So you can write whatever you want your program to be. So you can be malleable in how you tailor your approaches for a community, and you can tie into the specific community nomenclatures of those folks that you are serving to make sure that the resources that you have within house are culturally relevant, they're on time, and they're things that people can take away, and they're things that they need. I think that the one thing that I have loved about working in the nonprofit space is that working in a nonprofit allows us to scope to be innovative. So we can take the research that's passed down to us from CDC, from the health departments, and we can look at this research and say, hey, look, what do we want to do? What type of public health principle can we apply to write an innovative program to kind of close those gaps and barriers, or to kind of solve the issues that the data is telling us? So it allows us to be innovative in our approaches to reach community, but also it gives community a space and a voice. Because dually within these nonprofit settings, we have people that are from community in which you work and serve, and you become a part of this community. So you're gathering information about what they need. You're gathering this information about what they experience. And that creates a full-fledged picture for you to be an advocate working in a nonprofit for those folks that you're servicing on every level, because you may have access to rooms that they don't have access to just by the privilege of you working in this space. So meeting people where they are, being the voice for the voiceless, but also having the awareness to be innovative in your approach so we can begin to tailor the needs of our community, especially within HIV, because as we know, HIV is so much more than sex. It's where you live, where you work, where you play, and where you worship, and how you worship sometimes. And so being in the nonprofit space, it allows you to adapt and to be valuable enough to service people holistically, wherever they are in life.
Thank you. Okay, this is for all panelists. We're going to start with you, Chris. Speaking of whole person, I'm sorry, let me backtrack. This is for all panelists. How can we take a systemic whole person health approach in Black communities?
I think it's just one, meeting people where they are and acknowledging that sometimes life's lives. And when life starts to life, we have to create spaces for people to live. And so as us being public health practitioners, we have to be aware of how these pandemics intertwine with each other, right? Folks who are most vulnerable for mpox were the same folks who are most vulnerable for COVID-19, were the same folks who are most vulnerable for HIV, and that's due to systemic inequities. So if we can solve some of these structural barriers at a systemic state, we'll start to see a shift and a change. But we as public health practitioners, we have to be ready and prepared to meet the needs of those folks that we're servicing. And what I'm not saying is that you have to provide all those resources, but what I am saying is that if you don't have those resources to provide, you can collaborate, you can connect, you can make not a warm handoff, you can make a hot handoff for folks in need, because these are the things that they remember. Because if we're here to service people, we're here to service them holistically. And as you as being someone, a part of the community in the nonprofit space, in the for-profit public health space, it's your initiative to know what's in your community so you can best service the folks that you're servicing. But what that approach looks like is us being diverse, us being willing to think outside of the scope of our work to attend some of these meetings that talk about equity, that talk about criminal and juvenile justice, that talk about HIV, so we can know what's going on in our communities, because there's so many things, that there's so many ways of how health and health disparities intertwine amongst all pandemics that a lot of us fail to realize because we don't take the initiative to be in these rooms to understand. But once we come to understand as public health practitioners, we can start to galvanize the response about what we understand, so we can start to advocate, empower, and engage the folks in need in correct ways so they can make sure that they're okay.
Dr. Fanfare.
Well, first, preach, Chris. I love that hot handoff. I'm gonna have to ride with that. I really like that. And I think he spoke to a lot of the points that are really important, you know, as we think about whole person approaches and where people, you know, where are Black people already seeking care? Like, people here at my division know I don't want to hear about hard to reach or, you know, any of that. People are living their lives out there. Are we doing what we need to reach people where they are? And so I think syndemic model gives us such a nice opportunity to think about the work that can come into STI clinics or family planning clinics, or where you're seeking gender affirming care, our community-based organizations, right, that are in the community, hopefully led for and by our people. How do we ensure that that infrastructure is there? Because so much of that work is going to be there. We're thinking we might want to have someone start a prep. They might need a space where they can talk about and receive trauma-informed care, or where do I get safe housing, or where do I get employment? So ensuring that all of that is kind of this one-stop shop, I think, is really important in the syndemic space, because here we're talking about HIV, it's NBHAAD. We can be having the same conversation about syphilis, same conversation about gonorrhea, same conversation about who's receiving hepatitis treatment, right? And so I just think that it's really important that we think holistically for our people and how we're able to meet them where they are with what they need.
Dr. Hickson.
Yeah, I would just add that with the even going back to the question to Chris about nonprofits' engagement in ending the HIV epidemic, I think is all connected, in that as nonprofit organizations, we have to also understand our place in community and how, and also doing internal assessments to see what all services we can provide, because as we are reaching people where they are, their concern at that particular moment may be about food, right? It may be about, where am I going to sleep? So we, as even Chris mentioned with the hot handoff, but also looking at it, is that a service that we can provide, and how are we being innovative ourselves to bring all of these services to our community? And so as I think about this whole person, I just think about all the things that we've talked about, from the individual things to the social network pieces to the neighborhoods to also policy. That to me is whole person care. As I was riding in or driving into the office, was listening to some of the new policies and bills that even DC Council is putting forward, and they're talking about now this point system. about if you get 10 points, you get your car booted, right? So now your car gets booted. That's an extra expense that takes food, money from other places. And we know in DC where they already have an $8 million surplus of speeding tickets and all these other things, that these monies don't trickle down to our communities. And so we have to think about it, if we're thinking about the whole person, that it's not just about about the sex we're having, how we're having it, who we're having it with, but it's also all of these other social determinants of health. Do I have a stable home, right? Am I able to even, and if I am accessing housing, is this even furnished housing? Because I didn't even have the resources to get a home. So now I'm walking into a butt naked apartment and sleeping on the floor, right? So we have to really think about how we think about the whole person. And also, and just as the last piece, and I'll hush because I know I can go on for this for a little while, but also at the policy piece. And I think this is critical to where nonprofit organizations need to demand seats, right? Because it also is where and how funding gets to communities and what other things that are happening, right? And so we recently, we've been here at Us Helping Us, we recently received some syringe service program dollars. And in listening to communities, especially Black gay men who inject drugs, specifically crystal meth, we developed a wellness retreat where we take them to either Rehoboth Beach in Delaware or Deep Creek in Maryland, and actually engage in mindfulness activities to really get at the root of the engagement in this behavior, right? And while also considering harm reduction principles. We're now told these retreats are not part of SSP and they're unallowable, right? But this is community telling us that this is what we want. So now it's up to us. Yes, we don't want to bite the hand that feeds us, but to push back gently and to also say, here's the data that has moved these individuals from whatever behavior on along this continuum, not always preaching abstinence, because we're not going to yuck nobody's yum, but also how to engage in these behaviors safely.
Thank you for that. Dr. Fanfare, how are we bringing Black women into the conversation about HIV prevention and PrEP?
Thank you, Brandon. Well, I'll love to highlight some of the things that we're supporting here at CDC, and then kind of hear from the group. But I really do appreciate the question, because if we think of our cis and trans sisters, I think that it's really important to be centered, and that to recognize it's impossible for us to protect the health of the nation if we don't first protect the health of Black women. So it's really been wonderful to see some movement, because sisters have been doing this work for 40 plus years to ensure that there continues to be a seat at the table. And of course, if that table hasn't had a seat for Black women, many have created their own table. And so we just think about ways that us at CDC can continue to support so many of our cis and trans sisters who are out there doing this work. A couple things I'd love to highlight in the PrEP space. We talked a little bit about the PrEP disparities. And when I go out and we engage so much, so many women do not realize that PrEP is for them and could be for them. And I think that goes back to a lot of the marketing or messaging that people will see. And so Black women at CDC saw that need and were able to create a campaign, call #She'sWell, that was for and by Black women, so that they could see themselves and understand who's taking PrEP, what is PrEP, really to help with that awareness and uptake. We talked a little bit about Together Take Me Home. Some people don't want to go into traditional settings and receive an HIV test. I'm continually pleased by a lot of Together Take Me Home, but the proportion of people who had never previously been tested for HIV, who have now been tested for HIV with a self-test kit, is really shows us that there's more need for innovation and pushing the needle, as I said, kind of out of those traditional spaces. We've talked about whole person approaches. We have Her PrEP and we have Transcend. These are both demonstration projects that are looking at implementing these whole person approaches where women, cis and trans, are already seeking care, where they're receiving their women's health, where they're receiving their gender affirming care. And that's a space to have those conversations around HIV prevention and PrEP, and then of course linked to treatment. And so I think those are some of the things that we're doing, but it's really important that we continue to engage our cis and trans sisters in these conversations. They've been doing this work for 40 plus years. Just in this role, I hope to just continue to be able to support them in the work that they're doing to ensure that they're centered, affirmed, and empowered.
Thank you. Let me ask this, Dr. Fanford. What responsibility do you give men, even though it's a woman issue? What responsibility do you give men on that issue?
I think men have been really, really powerful allies. I think, thinking specifically about all men, but I'm talking specifically to my same gender loving brothers, I think have been really great allies. And we just need to continue to work together. There are those spaces for solidarity, and there are those spaces that need to be separate, right? And I think that we just need to kind of continue to work under that lens. DeMarc spoke so eloquently about the different situations. We're Black people, we are not a monolith, right? And so each of the communities, and even among cisgender Black women, there are different things that we're all dealing with. And so I think just to continue to be allies, understanding that there are those spaces where we need to be separate, but there are those spaces where we need to continue to uplift each other and work in solidarity.
Thank you.
But Brandon, if I could add
Yes.
quickly, that I do think that heterosexual or self-identifying heterosexual Black men have been largely left out of the conversation for way too long, and we don't talk about their engagement in this work, right? And so it's either largely because they may not see themselves vulnerable for acquiring or transmitting HIV, or that it's a issue for them, right? Because I think when we even talked to heterosexual men, my brothers included, where they're more concerned about herpes versus HIV, right? And so it's really thinking about how do we engage cisgender heterosexual Black men in this conversation, because we can't not have them involved in the conversation.
Thank you. Dr. Hickson, given your experience with us helping us and My Brother's Keeper, what strategies have you found most effective in engaging Black men who have sex with men in conversation and actions around HIV/AIDS prevention and treatment?
Yeah, thanks, Brandon, for that question. I think it's a number of things. When I was at My Brother's Keeper, the Becoming a Healthier You program, I think, was one way, one entree into that, where it normalized HIV testing in the overall standard of care practices, right? So we know as Black folks, we have a higher risk of hypertension, diabetes, hypercholesterolemia, kidney disease, all these things. So really normalizing testing within this body of screenings, that we were able to really normalize HIV testing. And also, then the second piece I would definitely say is creating safe and brave spaces. I remember coming to My Brother's Keeper, and Gerald Gibson and Christopher Roby and Cedric Sturdivant were hosting these interventions, whether it was Dia, Many Men, Many Voices. So really creating spaces for Black gay men to come in and talk, and that it's not just always about HIV, right? Because I've been around for a while, so I've been around since BET and Wrap It Up and all these things. And sometimes, the conversations start to get a little old when we just only talk about HIV and sex. So really creating these different spaces for Black gay men. And then I think finally is really understanding their networks, right? Black gay men are not alone. Most, they have families, whether chosen or biological, and we have to consider their families and their networks within their care as well, right? Because oftentimes some Black gay men may be the caregiver for many folks in their family. So they are also ensuring the health of others in their network. So we really have to also think about Black gay men as more than sex, more than HIV, and really understanding, because there's Black gay men who also want to become parents and all these other things. So really thinking about Black gay men as a whole and in this whole person health framework that we've been discussing.
Thank you. And you mentioned becoming a healthy you. I think the power in that program is that you mentioned hypertension, you mentioned things of that nature, liver disease. So becoming a healthy you is more like a gateway.
Mm-hmm.
Now we can service you in terms of getting tested for HIV, syphilis, and things of that nature. So that's the power, and then it kind of, I guess it eliminates the stigma a little bit. But I think it's a powerful gateway to make sure we all are tested and ultimately treated for HIV and AIDS.
Absolutely. And changing the conversations, right? We're able to talk about our amlodipine for our blood pressure, or our metformin for our diabetes, but why not? Let's talk about the Descovy or the Apretude or the Biktarvy for treating HIV or preventing it, right? So just normalizing the conversation as we're talking about medications and all those other things. So yeah, I'll stop.
Right. Mr. Walker, as a CDC Let's Stop HIV Together community ambassador, president of the Gulf Coast Kiki Ballroom Singing Allowance, and as a podcast host, how do you best use these different platforms to raise awareness about HIV/AIDS issues and advocate for change within the Black community? Two-part question. What unique opportunities do these kinds of community and cultural engagements present in the fight against HIV/AIDS?
I think just for me personally, and anybody who knows me will tell you and will tell everybody that Chris Walker is one person who was going to authentically be himself 100% of the time. So I think that no matter what space that I show up in, if it's professionally or personally, if it's on social media or if it's as an ambassador, I'm always thinking about how can I use who I am to be a voice for the voiceless, to really create spaces to where, one, I can talk about the needs of those folks impacted by HIV, those folks who look like me, love like me, and are connected to other folks like me. And beyond, how can I address their needs? How can I talk about their needs in a systematic way? But also, how can I use my connections and resources to create a space to where I'm engaging, educating, and empowering those folks who look up to me for advice, or those folks that I have influence in on how they can enhance their overall well-being? Because I can acknowledge I'm a lover of the stages of change. And so, going through pre-contemplation, contemplation, preparation, action, maintenance, and relapse. And I tell people my job in life is not to save your life. That's on you, because you need to be empowered to take control over what you got going on. But what it is my job is, I need to be able to give you a seed of knowledge that you can grow into whatever plant, flower, tree, root, carrot, whatever befits you in the moment, because you have to be empowered to make a change. I can want to change the world for you, but unless you are intrinsically motivated to make that change, it's never going to happen. And so I use the work that I do, the platforms that I'm on, and the podcast, and this opportunity as an ambassador to advocate for folks in innovative ways to encourage them to keep on going. As I said earlier, but lives you have to choose to live, and there are resources out there that can help you live. And as that relates to HIV prevention and treatment, there's ways on how we can use our platforms and who we are in our being to reach other people that we have influence over. Don't be afraid to be innovative in how we engage with people through arts, advocacy, and culture. Ballroom has been a great way for me to be able to connect with other queer young people impacted by HIV, to apply, to navigate into resources through just simply teaching them how to vote, teaching them how to walk face, or creating a space where they can feel connected to a family, because their biological family wants nothing to do with them because of who they are and who they choose to love. So figuring out these ways to meet the needs of people where they are through arts, advocacy, and culture. And when you're in these spaces, you're not just only present, but you have presence within that present, and you develop a relationship. So when they have something, or where they feel comfortable enough with you, when that rapport is developed, they feel comfortable to address and to talk to you about what they need. And then you as an advocate, you as a mentor, you as a public health professional, you as a manager, you as a whatever, can say, hey, look, you know what? I got you. And I have those resources that you need, so you can just exist, so you can survive, and so you can be okay. But for me, first step one is showing up as myself. The song Bag Lady, you gonna hurt your bag. Wherever I go, I carry me in all my bags. Okay, call me Mr. Bagman. But I do that because I assume many identities, and through those identities, I can reach people and have presence within me being present, right? And so once I have developed that, people know that they can use me as a resource, and I can innovate to figure out how can I reach them where they are to meet their need, right? And so that translates to HIV, because like I said, HIV is so much more than sex. It's where you live, work, play, and worship. And if we're talking about catering to holistic approaches, talking about financial health, emotional health, social health, digital health, behavioral health, physical health, mental health, sexual health. We have to be able to meet people where they are and be able to use all of these catalysts as a route for change, especially as it relates to Black folks within Black communities.
Great. We have a couple more questions, and then we're going to go into Q&A. But this is to all the panelists. What is your charge? What is your call to action to everyone on this call as it relates to ending HIV in the Black community?
Oh, go ahead, Chris. Oh, well, I'll go. I think mine is around civic engagement. I think that we have gotten to a point where we've been dependent on others to make the necessary change that we need to see in order to end the HIV epidemic in our community. I think nonprofits have the opportunity, as we talk about empowering folks around their health, their overall health. We also have the opportunity to empower communities in their right to vote and to get out there, exercise the right to vote, right? So yes, we are nonpartisan, and yes, registering somebody to vote is a nonpartisan activity. So engaging communities in that and to get out and vote, and it's just not for presidency or for Congress, it's also for state legislature, governor, state representatives, as well as city and county council. I'm here in a jurisdiction that our governing body is a city council, and our budget is determined by Congress, right? But we do have the power to also engage with city council as well as neighborhood commissions to really make change on the ground. And so one of the things while I was at my brother's keeper was, or as it is even said now with Dr. Gibson, that if it can be done in Mississippi, it can be done anywhere, right? And so as we can get out and really engage communities to make change, to really engage in social and civic engagement such as voting, that we can do this anywhere. And as I think I saw it for NMAX coming up, USCA conferences, as the South goes, so does the HIV epidemic, right? And so really getting engaged, because again, HIV is more than sex.
Dr. Fant?
Yeah, I think my charge to everyone, there's so many, but since DeMarc used kind of one phrase, I'll use a phrase and then kind of explain what I mean by it, and I'll say self-love. I think, the way I've been trying to move this forward is taking us away from language that's risk, right? Who's at risk? I don't think about my life that way. I'm sure nobody thinks about their life that way. So when we think about knowledge being power, an HIV test can be an act of self-love. When we think about something like PrEP, that's really life-saving and game-changing, taking that can be an act of self-love. I think for us here who are doing this work, replenishing our cup and making sure that we take that time, that's an important act of self-love. To act as if anyone who's been doing this work over the years, decades, it's been hard. I think when we see what's going on in certain states to the communities we come from, the communities we love, the communities we serve, it's hard. So I think really making sure that we take that time to replenish our cup so we can continue to do this work from a space of joy and love is really important.
Mr. Walker.
And I would say, I would like to empower you all to acknowledge your own advocacy. So a lot of times when we talk about advocacy and the work that we do, people expect or think that you have to be the person to tell your story in a room full of people. You have to be the person that's engaged directly in testing. And no, you don't. I feel like everybody is born with a set of tools that they can utilize to really spread the message around HIV prevention, treatment, and access to care. So I want to empower you to acknowledge your own advocacy. You can be somebody who wants to donate. You can be somebody who wants to plan a community event. You can be the person who wants to say, hey, friend, have you gotten tested? It's been 3 months. I'm gonna go with you and I'm gonna hold your hand while you do it. Because once you're charged better, once you understand better, then you do better. And the work that we do is not my work. It's not Dr. Farrar's work. It's not just Dr. DeMont's work. It's all of us work as a collective. And only through our collective work can we finally end the HIV epidemic within Black communities and within communities abroad. But first, we have to learn how to acknowledge our own advocacy. Look at the space that you take up and learn how to utilize and maximize the space that you take up to be impactful within the HIV landscape.
Thank you. Well, I'm gonna give my charge too. To Dr. Hickson, to your point, I'm gonna charge our heterosexual brothers and sisters to eliminate the stigma, because HIV/AIDS is not a gay disease. It's a disease, period. That's all I have on that. All right, so this is to all the panelists. What is one development we can expect to see from you or an organization you work with in the near future, as it relates to ending the HIV epidemic, and how would it benefit the Black community?
Well, I'll go first. So I actually just recently made a job transition from VP Healthcare to now doing nonprofit work. So I'm doing a lot of community engagement work here in Dallas, Texas, at Abounding Prosperity. And so my goal and what you all can expect to see from me is that figuring out ways to infuse HIV education and awareness within arts and culture, and meeting people where they are through speed dating events, through paint and sips, through ballroom activities, through pageant, through karaoke nights, because we have to get out of the context of servicing people in traditional ways, because the rates of the epidemic are still on the rise and things aren't changing as progressively as we would have assumed. So if we want to see these EHE goals by the year 2030, we got to think outside of the box. So you can expect to see Abounding Prosperity thinking more creatively on how we can service the Black community here within Dallas County. And if you ever come to Dallas to visit, pull up on us at 1705 MLK. We're here for you.
Well, I'm gonna jump in so that we can save the best for last and have Dr. Neville Fanfair go last. And as a executive, you just can't give one development, because you always have so many things going on. So I'll try to limit it to about 2 or 3. So the first is for us helping us that we're really looking at the space of housing, right? We've been talking about housing, trying to find partnerships, but we know here in DC and the greater DC area that housing is a problem, universally, affordable housing in particular. And so we're really looking at to end the HIV epidemic by providing and moving folks to permanent housing. The second is really replicating models that we've seen be effective. And I want to lean into Open Arms Healthcare Center, where as part of our housing work and some of the work that we're having done in our renovations is also to move into owning our own pharmacy and having all of these particular services here on site. So when we talk about co-located medical, behavioral, and social support services, it's all right here, right? And you don't have to go too many other places to really have all of the services that you need provided. And then in the near future, last thing, and I'll leave on kind of a high funny note, I've now eclipsed 200 followers on Instagram. So hopefully by my birthday in March, I'll have 300. So you can follow me at the.blackonstein on Instagram and help me to get to 300 followers.
Nice plug.
Nice plug. I might have to follow you. And I'm laughing because anytime I do the Instagram lives, shout out to my communication staff who's like, this is how you do it. Because I don't know, I probably have like 8 followers on Instagram. I'm not really living that life. So 200 sounds like a lot to me. You are a full-on celeb, Mark. What I would say, one of the developments I'd love to see that we have going here at CDC and continue to elaborate in 24 is coming into community, right? This is not an ivory tower, and making sure that we are out there. And so just last week, we're in Houston. Sorry, I didn't roll up to Dallas, Chris, but we were in Houston last week. In a couple of weeks, we're going to be in Baton Rouge. We're going to Memphis. So really the time that we spend outside in the community, listening and hearing, as I said, community knows what community needs, right? So that's my job job to ensure myself and other leaders in DHP are out there in the South listening and taking that back and thinking about how that impacts our capacity building, our program, our policy is really important. I think other things that we have, coming out this year are large notice of funding opportunities when we think about the work we do in health departments and capacity building. I hear so much from our community-based organizations, the needs that they have for capacity building, for grant writing, for things like that, to be able to continue to do this really critical work that's so often led for and by our people. So I'm really proud about some of those that are coming out. And then thinking about ways that we can continue to uplift the voices of so many who have been doing this work. If that's coming into spaces like CDC so that people can hear directly, we think about things like CHAC, which is our advisory committee, thinking of opportunities to affirm and uplift voices in that space so that it's not just me, but it's other leaders all the way up in HHS who are hearing directly from our people about, what it is that it'll take, what it is that we need. Because as Chris said, and I often say, in 2030, I don't want to get there and say, wow, we ended the HIV epidemic for some people, but we didn't end it for our people. So I think that our time is now in 2024 to start so that we can make sure that we get where we need to in 2030.
Great. I'm going to put in my plug too. All right. Instagram, Open Arms Health, NBK ORNG, and also Facebook, Open Arms Health, and NBK ORNG. Then we have YouTube, NBK YouTube channel, MBK INC. All right. So I think we have a lot of chatter. We have a lot of Q&A going on here. So they got questions, we're expecting answers. All right. Looks like we may be able to get to all of these. Okay, first, what message would you have for someone dealing with HIV, diagnosed at childhood trauma? What message would you have for someone dealing with HIV diagnosed and childhood trauma from religious family being a Black gay male?
I would say there's life after this. So one, with me being a person who was diagnosed with HIV as a victim of sexual assault, being a gay Black man from the South and having to deal with trauma within my family, trauma from the situation, and me being stuck in that situation, I had to come to a point to where I understood that, yeah, it happened. But guess what? I was built for it and I made it through, and there's life after. I think that a lot of times when people are diagnosed with HIV, they think of it as the end. I can't love, I can't be loved, I'm not going to have family. But I'm here to tell you, if I can do it, so can you. There's tons of resources, there's tons of communities for you, and you are more than HIV. HIV is just another part of you, like the shoes that you wear on your feet, like the color of your skin, or the food that you like to eat. It's not your complete identity, it's within you. You make it and it does not make you. Don't give up, keep living.
Thank you for that. Next question. Yes, there will be a video recording of this on the NBHAAD website, and we will also send the link in an email. All right, next question. How do we break down generations of medical mistrust within the Black community? Ooh, that's a good one.
That is a really great question. And I know we've been having conversations about that. And I really think that it starts with the generations behind us, right? That I think as we talk about in this work, how representation matters, representation also matters in the medical field. So having Black MDs, having Black nurses, having Black optometrists, having Black veterinarians, having Black every profession possible, right? And so really leaning and giving back to those who are currently in middle school and high school and working with local schools to help generate the next generation of doctors that will be, and other folks working within the healthcare system. Because again, and I'll just leave it as representation matters, and it matters from the State House to the boardroom to even within medicine.
Okay. Next question. How do those of us who work in clinic spaces connect better with and collaborate more with community-based organizations. Ms. Simone stated, I often try to reach out to local organizations, but rarely get responses to my emails and phone calls.
So I say this all the time. When it comes to working in community and for community, so there's a difference between being present and having presence. So everybody has the capacity to show up, to be present. But once you have the opportunity to be present, you have to have a presence in that. Because a lot of times too, when working in the community space, you have people who are from those communities who work in these spaces who are advocates for those people with those lived experiences. And so they have dealt with tokenism in the past, right? And as a tactic to protect their community, sometimes they're a bit hesitant about working with people. You just have to make sure that you have presence when you have the ability to be present and you show up, right? And show up not because you just want to do an event or not just because you want to collaborate, show up to learn, show up to be someone in the room, show up to say, hey, I'm so-and-so, and I just wanted to come and support you all. Because from the aspect of working in the nonprofit space, we see folks outsiders coming. The first question was, what do they want? Why are they here? And so to get around that, you show up just to be a member in the room, show up to just listen and show up to learn. And then as you start to build this rapport, this relationship, it can create a mutually beneficial partnership to where you can come in and, you'll be received differently. So if you are struggling with that, figure out how to have presence, but then you being present, but just pop in and show up. Sometimes you got to get off their phone and get off their email and just say, hey, my name is so-and-so, so-and-so. I want to come and visit you all, learn more about what you do. This is what I do. Can I talk to you for a minute? Sometimes we got to get out of the virtual space because also in the nonprofit world, we got one person doing 5 and 6 jobs. And that's just being real. So we might not have time to answer every email, in 24 to 48 hours, or we might not always be available to answer the phone. But if you pop in, it shows us that, hey, you want to be a part, you just want to come and learn.
Thank you for that. Here's another good one, guys. How can we focus on providing care for individuals via focused testing, education, and advocacy, and linkage without making them feel as though we are targeting them to meet a metric?
I'll start. I think it's so important what a lot of this conversation has been around in this whole person approach, right? We framed the disparities and why those disparities exist, but no one wants to feel, I think the person used the word target. So going back to something DeMarc said, and shout out, I do take amlodipine, right? We want to be able to normalize those conversations around the medications that people are taking, something I'm so proud of. Yes, I do happen to see veterans with HIV, but I'm a primary care provider. So we are having those conversations about hypertension and diabetes and prostate screening and all of that in addition to HIV. So I'm just hoping that there are ways that we can bring HIV testing and prevention and linkage to treatment into spaces where people are already seeking care and really normalize how important all of those are to our lives, but also that really helps, I think, with breaking down stigma. People might not want to feel like they're walking into a CBO that is seen in the community as focused on HIV. Now, there's so much more that goes on there, and people will learn that in those doors, but sometimes we don't know what's going on outside and the stigma that certain places can have. When I was in Baltimore, I worked in a place that had infectious disease in the title. Some people don't want to walk in that door. And so I think thinking about ways that we continue to uplift the work in those spaces, but that we feel like HIV prevention and testing is now coming into spaces where people are already seeking care, CBOs where people are already seeking so much to help with the social determinants of health, I think can help people feel, quote unquote, less targeted. Even though I wouldn't use that word because once again, all as Black people, we feel targeted. And so I think that's also important in the language, not for that question, but just in general, I make sure in the language that we use that we don't say, we have programs that are targeting people because once again, we already feel targeted. We don't need programs or anything that makes us feel more targeted.
Right, great. All right, kind of running out of time here. We got a few more questions here. Oh, we got that one. What is too early to bring exposure to the youth on this topic? HIV/AIDS awareness.
I don't think it's at any age in which is too early. I
Mhm.
think it should be a proactive approach. Should be a proactive approach, and I say that because us helping us, we recently established a school-based clinic at a local at the Seeds Public Charter School of Washington, D.C. And in just some of our work, we've had 2 of our scholars who are already single moms. They came in 9th grade, right? And so it's not too early. We have to be proactive in educating folks, especially youth, in terms of sex and the practices that should be utilized that not only prevent the transmission or acquisition of sexually transmitted infections, but also in this case, teen pregnancy, right? And so we, again, I don't think it's too early. We know PrEP, I think is what can be prescribed for somebody who weighs 35 kilograms. So they took away the age piece there. So now it's about when somebody is engaging in these behaviors, and we can't wait for somebody to come up and tell us that it's dripping or stuck to my leg or itching and all this stuff. We need to be talking early about sex.
Yeah. All right, guys. Also, people in the chat also would like you guys social media handles. So if you would, please submit those in the chat so they can contact you. Get it up, get it up, get it up.
I could get to 15, y'all.
As we draw this significant and enlightening event to a close, I would like to extend my heartfelt thanks to each of you for your active participation and engagement. Our discussions today in honor of the 25th anniversary of National Black HIV/AIDS Awareness Day have not only shed light on the critical issues surrounding HIV/AIDS in Black communities, but have also illuminated the path forward with hope and actionable strategies. A special thanks to our esteemed panelists, Dr. Hickson, Dr. Fanfare, and Mr. Walker, for their invaluable contributions and insights. The expertise and experience have undoubtedly enriched our understanding and commitment to this cause. As we part ways, let us carry with us the key messages of engagement, education, and empowerment. The discussions today have reinforced the importance of unity and collective action in ongoing battle against HIV/AIDS. Let's continue to build on the knowledge that's shared here, applying it to our various capacities to make a tangible difference in our communities. Remember, the fight against HIV/AIDS does not end with this event. We encourage you to stay connected and continue the dialogue and actively participate in community efforts. Your role in this journey is crucial, and together we can strive towards a future free from the impact of HIV/AIDS. For those who wish to revisit the discussions or share them with their colleagues and friends, a recording to this webinar will be made available. Keep an eye on your emails and our website for the link. And for more resources, visit My Brother's Keeper website, nbkinc.org, or Let's Stop HIV Together, cdc.gov/Stop HIV Together. Thank you once again for joining us today. Your presence and involvement have made this event not just a commemoration, but a beacon of hope and action. Stay safe, stay informed, and continue to make a difference. Thank you, guys.